We are live now, doctors.
A very good evening and a warm welcome to this grand event UC Quiz 2.0. It is indeed my privilege to be hosting this along with my co-quiz masters, and a very warm welcome to each and every one of you who's joined us on this Wednesday evening to participate in this version 2.0 of UC Quiz. So it all started off initially as a collaboration between myself and Dr. Prasanna. This happened in the year of 2022, where we had done a Silver Jubilee quiz in the month of September as the second capsule. And along with that, under the banner of YOSI and TNOA, it was followed up in 2025 as a part of Summer Showers quiz as well. And then we went on to host the first ever edition of this YOSI quiz in the year 2025 under the able guidance of the current governing council. Myself and Dr. Karthikeyan Mahalingam were the quiz masters, and we started off on a smaller scale where we tried to cover PGs and young ophthalmologists across the state of Tamil Nadu. But then came a landmark event where our governing council, headed by our able president, Dr. Divakant sir, signed a memorandum of understanding with the prestigious APOS, Andhra Pradesh Ophthalmic Society, on the 21st September 2025. And there began another collaborative journey. And this culminated into what we have today, the Grand YOSI Quiz 2.0. YOSI, along with APOS, is conducting this quiz with 4 quiz masters, and it's grown by leaps and bounds. I sincerely thank the governing council for making this possible and making this dream into a reality today. And I request our president of YOSI, Dr. Divakant sir, to address the gathering.
Thank you so much, Niranjan. Indeed, I mean, it's a very proud moment for me personally to see these initiatives flourish the way they are. And you talked about our collaboration with APUS, and I was so lucky to be there. And the hospitality and the respect that we got in that event was at another level. And what I am seeing is how our team is encouraging new leaders, Dr. Raghav, Dr. Sudhakar, and of course Prasanna is there with you guys always. So I'm very happy to see people taking up new responsibilities, doing things with such great sincerity, and as a byproduct, as the main product, also imparting knowledge and encouraging other young ophthalmologists. So very happy to see this, the way all of this has turned out. And whatever support all of you guys need is more than 100% is there at your disposal from our side. So best of luck to all the participants. Best of luck to all the quiz masters and thank you to them for taking out their time and doing this so beautifully. Thank you, guys.
Thank you, Devakant sir. And we wish you a hearty, happy birthday on this very special day from the organizing team and all the participants who've joined us today. And have
Thank
a
you so
safe
much.
trip to
Thank
Hong
you.
Kong, sir. Thank you.
Thank
Thank
you,
you for
Niranjan.
inviting
Thank
us.
you so much. So nice of you.
Thank you, sir. Next, we have our dynamic secretary, Dr. Nilesh Kumar, sir. Sir had agreed for conducting this quiz within 5 minutes. That's a record response time from sir. I had just put a mail late night and sir said, just go ahead. Sir, we are very happy to have you with us. A few words from you, please.
Thank you, Niranjan. Thank you for giving this opportunity. You have that governing council is supporting you, but I think it is kudos to you and your team that there are so many initiatives that is being discussed, but I mean, if you actually see the light of the day, so it is because of you and your zeal that this has entered third edition. First was a small event, and then these two grand events that happened last year, and this year it is even grander. So kudos to you. Keep up the good work. And it's for us, it's very easy to say yes. The hard work has to be done by you. Keep doing that. And I would like to take this opportunity again to invite everyone.
Yes, sir. I think there is some issue with the audio.
Uh,
Yeah, it
we,
got broken, sir.
now, now it, so I'm on behalf of the UOC Governing Council, I'm going to invite everyone. Niranjan, can you hear me?
Yes, sir. Yes, yes.
Yeah.
We are eagerly
So
waiting for
Niranjan
the
is going to
invite, Nilesh.
Where are you inviting us?
So Niranjan is going to conduct the quiz there also, and I would like to invite everyone who is here to come for the physical event, and the prizes will be even grander. This time we have prize where AIOS and UOC-CON registration is complimentary along with some cash prize also. So next year, Dr. Aditya Sethi is here. He will promise even grander prizes. So welcome everyone to UOC-CON. The registration is going to start within this week, I think. Thank you.
For
Thank
those
you
who
so much.
missed the gaps, he meant YosiCon 2026 at the Pullman in Delhi, Aerocity. And this will be in July, so please be there.
And all winners get one-way ticket to Cayman Island.
One way
And
only.
one way only.
Next up,
Return flights only.
next up, I would like to convey the wishes from our Vice President, Dr. Karan Bhatia sir, who is also quite busy at KPAO Hong Kong, and he conveyed his wishes to our organizing team and the participants. All the best. Next, I would like to invite Dr. Aditya Sethi sir, who's joined us all the way from Cayman Islands. Sir, a few words from you. He's been a constant supporter of hosting this quiz and has helped us get the prizes and awards for the quizzes in the past in UOC-CON as well. Sir, a few words from you, please.
Thank you, Niranjan. I think all credit goes to you and Raghav. I know, Raghav, this was just a conversation we both had in Delhi, and then that led to Prasanna taking over and getting APOS and Yossi to sign hands, and Devakant being there, and now Niranjan is doing the next leap, which is getting the quiz going. So, like you see, that everybody is involved. That's what Yossi is all about. It's not an individual act, it's just everybody coming together. And kudos to all you guys. Well done. Excellent. Like Divakant said, whoever wins this will get a return ticket from Cayman back home. So please do this very well. And I'm looking forward to meeting everybody physically in Pullman very soon. So please be there. And I know Divakant, APOC, right? Asia Pacific Ophthalmic Congress is actually Andhra Pradesh. I hope you didn't buy the ticket to Hong Kong.
No, I mean, jokes apart, what Aditya said, it's so important for us to interact and network. See, a simple conversation is leading to so many things. So all of us should connect whenever possible and speak and do things together.
Incidentally, that was in Pullman too.
Yeah, true.
So
was over
life
lunch at Pullman.
has to come a full circle now.
Absolutely.
Definitely, sir. Next up, I would like to invite our Joint Secretary, YOSI, Dr. Prasanna Venkatesh, who is joining us live from Hong Kong. As you can see, he's been a pivotal person in this wonderful collaboration between YOSI and APOS. So over to you, Prasanna, sir.
Thank you, Niranjan. Hope I'm audible and
Yes, sir.
there are no network issues. Yeah, thank you to the whole team led by Devakant sir, and a special shout out to Raghav and Sudhakar. Again, two good colleagues and friends. So when we wanted to get the MOU done, I think this is one of the state societies where we had the MOU launched during the inauguration, and both the associations joined hands for the welfare of the young ophthalmologists nationwide, as well as to uplift the people from Andhra Pradesh. So a huge round of applause to both of them. And to see Niranjan taking over, he's a very good quizzer himself. And so that is when we decided that Niranjan, it's time you have to move to the other side and be the quiz master. And what we have done during this leadership is we have tried to identify strong state associations where YOSI is now getting into collaborations with MOU with the state organizations. And we are trying to unearth new talents in young ophthalmology, be it residents and fellows. And I think the whole governing council, Devakant sir, Nilesh, Karan, Sonal ma'am. Again, Aditya, again, a shout out to you because Aditya started this with a simple conversation between him and Raghav, and here we are. And I thought I won't get my visa, and I was supposed to be one of the quiz masters. I just got my visa 24, 36 hours before my journey. So it's unfortunate I'll be missing out on this as a quiz master, but Niranjan has left no stone unturned on behalf of Yossi, and Dr. Raghav and Sudhakar has left no stone unturned on behalf of APOS. It's not APOA, it's APOS. And so definitely looking forward to a huge event. And I think the volume speaks for itself, Niranjan, Raghav and team. I think just keep the wonderful work going, and we are there to support you guys in any way possible.
Thank you. Thank you.
Back
so
to you,
much.
Niranjan.
Thank you so much. Though you couldn't be there for the entire quiz, thank you for contributing with wonderful questions for the quiz as well. And looking forward to more wonderful collaborations between UOC and APOS, sir. Thank you so much.
Thank you, Niranjan.
Thank you, sir. Next up, I would like to thank and invite our industry partner for this venture from Beatum Pharma, Mr. Luman Raj. They have been a constant support for this particular initiative, and this is the second edition that they are consecutively supporting in conduction and for the awards of the prize winners as well. I request Mr. Luman Raj, our RBM from Beatum Healthcare, to share a few words before we proceed further.
You have to unmute yourself, Mr.
Yes, sir. You're on mute.
Sir.
Yes.
Yes, sir. Good evening, sir. Good evening, respected organizers, esteemed doctors, and quiz masters, and all the brilliant young ophthalmologists present here. On behalf of Beatum Healthcare, it is my great honor to extend our heartfelt thanks to the Young Ophthalmology Society of India. Actually, it is our second quiz program. Last year, we all participated the first quiz one. Successfully, we conducted the quiz. So thanks for the opportunity given by EOC. So thank you all, sir. We'll be continuing the support. Thanks for supporting us, sir.
Thank you, Mr. Luman. So I think all the participants have slowly but steadily logged in. We've crossed the 100 mark on Slido. So looking forward. So I hope all of you have joined us on Zoom as well. So this is our Dynamic Governance Council. And for today, we have the quiz masters, Dr. Prasanna Venkatesh Ramesh, myself, and it is indeed my privilege to introduce my co-quiz masters, Dr. Raghav Preetham. So he is a growing stalwart in the field of cornea, cataract, and refractive services in the state of Andhra Pradesh, a very popular doctor in his area, and he specializes in cornea anterior segment and refractive surgery, has done his training from LBPI, and has a strong academic footprint with several peer-reviewed publications, a very active society involvement shown member, and multiple recognitions for his clinical and research projects. Next, we have Dr. Sudhakar Naidu Laveti. So he is a consultant ophthalmologist, again in cornea, cataract, and refractive, with more than 8 years of experience, and has trained in NRI Medical College, Srikar Institute, and currently working as a consultant at Vision Tree Eye Hospital. So he's been an active academic contributor and has been an invited faculty and a wet lab trainer at several national and international platforms, including APOS, AOS, ARSI, and APAO, APACRS, and UCCon. So he's received multiple prestigious awards, such as the Pride of APOS, Best Paper Video Awards, and UC International Rising Star Award as well. We welcome you, Dr. Sudhakar. So for all the participants out there, here are the game rules. So we have 40 questions in total, right? So that is how it is going to be. It is going to be 10 questions per quiz master, and we are going to give you 15 seconds per question. And there is one correct option for each. No negative markings. And please do note that fastest fingers count. The shortest time and equal number of answers, of course, the fastest finger gets the higher position. And a slight change in the platform of quizzing, it's going to be Slido and not Kahoot. So as circulated to you in individual messages, WhatsApp and email, I kindly request you to log in using the appropriate names once again. This is to ensure that we are able to identify the winners correctly and reward them as appropriately. And I would like to here provide a disclaimer saying that the organizing team is not responsible for any network issues on the side of the participant. And last but not the least, the quizmaster's decisions stay final regarding the answers. So we have reviewed several sources and provided references for the same. And all the quizmasters have taken an ample amount of time in designing these questions. So there goes the final verdict. So with that, I hope we are clear about the rules of the quiz. So first up, this is how the order is going to be. First, Dr. Raghav will be presenting, followed by Dr. Sudhakar. And on behalf of Dr. Prasanna Venkatesh Ramesh, I will be presenting, and finally my set of questions. I hope that is clear. Right. So see you on slide.
Dr. Niranjan, small trouble. We have 108 participants on Slido, but we only have 70 participants logged in on Zoom. I think we'll have to inform them that they have to be on the platform as well.
Yes, we shall do that. So if you all are, see, one possibility of this happening is when 2-3 participants are sitting together and attempting this. But one tip I would give you is it's not going to help you much because the questions have been designed in such a fashion. So, and the time is also quite less. So your spontaneity is really going to be tested here. So if you haven't joined on Zoom and Slido at the same time, I sincerely insist you do that because we will be keeping a tab of whether you're logged in on both before we announce the final winners. So it is the wonderful backend team of Numerotech who's doing a fantastic job organizing this on 2 different platforms simultaneously. So I think it's better if you log in into Zoom and see the questions because, mind you, you are not going to be able to see the questions in full in Slido. All the images in high definition are going to be visible only on the PPT being shown on Zoom platform. So in case you're logged in only in Slido or your friends you know of who have logged in only in Slido, please do join us on Zoom. Maybe we will start sharp by 7:20. The first question will be read out by Dr. Raghav. So we have a couple of minutes. So in case you haven't joined us on Zoom, please do so. So unless I ask the backend team to start, they're not going to do it. So kindly requesting all of you to join us on Zoom as well.
Okay, you're going to share the slide?
Yes, sir. Yes, sir. Not yet. I haven't shared. I'll do that sharp at 7:20, sir. If that's okay.
I pinned the Zoom link on the WhatsApp group. If any of you are not on the group, you can, or if you are on the group, just use the Zoom link.
The number is increasing. We have about less than a minute. So kindly do join us there. Okay. So I think 7:20 we'll go live with the quiz. Okay. So as soon as my first question is shown, the timer and the question will be displayed on your Slido device. So I strongly insist that you follow both the PPT and the Slido timer, because after the 15 seconds, it's going to close the poll. Okay. All right. So let us start. Dr. Raghav, over to you.
So the first question for today's quiz, which of the following can measure posterior corneal astigmatism? Option A, Pentacam, B, IOL Master 700, C, iTrace, and D, all of the above. The timer is on, so it's fastest fingers first, so make sure you answer it quickly.
Yes, so the time is up. And another point I wanted to highlight is you could choose to answer the question based on what is being made visible on the screen as well, while Dr. Raghav continues with the question, because the timer starts the moment the question gets displayed on the screen. So let us quickly move on to the answer.
So the answer is D. All the above listed devices are capable of assessing the posterior corneal astigmatism, either directly or through tomography or ray tracing based modeling. We had 58% of people answer it right. So we are hoping to improve on that number from the next question. Moving on to the next question. Smile primarily uses which laser? You all know Smile. Now you have Smile Pro as well. The options are A, excimer laser, B, an argon laser, C, femtosecond laser, or D, Nd:YAG laser. That time's up. So the answer. So somebody is trying to answer on the Zoom chat. Please refrain from doing it. Otherwise, everybody's going to get a prize. That's going to be difficult for us. So the correct answer is C. Smile is performed entirely using a femtosecond laser platform, which creates a stromal lenticule within the cornea and a small incision through which a lenticule is removed. Whereas LASIK, on the other hand, is done on an excimer laser platform. Moving on to the next question. Which of the following is false regarding Bellin ABCD ectasia staging? I hope all of you know the ectasia stagings. It has 4 options: A, anterior radius of curvature, B, back or posterior radius of curvature, thickest corneal thickness, best spectacle corrected vision, distance visual acuity. I think the polls are done before I read out the question completely. But yes, I hope you all answered. Moving on to the answer. So the correct answer is C, because it doesn't look at the thickest pachymetry, but it is the thinnest pachymetry which makes it count. Next question. So a 20-year-old gentleman underwent photorefractive keratectomy 2 years ago. Based on his current clinical photograph and anterior segment OCT, what is the likely diagnosis? A, post-LASIK ectasia, central toxic keratopathy, C, post-PRK haze, and D, leukomatous opacification. The polls are locked. Oh, we had 71% answer it right. So the answer is post-PRK haze. This is a late complication that typically presents as central or a paracentral subepithelial haze. The patient will have gradual reduction in vision or contrast sensitivity. You can also note that there is a hyperreflectivity in the anterior stromal layer, which corresponds to PRK on anterior segment OCT. Like you can see it here. Yes. Moving on to our next question. All the following eyelid tumors can develop secondary to xeroderma pigmentosum, except A, squamous cell carcinoma, B, sebaceous gland carcinoma, C, malignant melanoma, and D, basal cell carcinoma. Incidentally, today is also the World Oncology Day. So you have an oncology question coming at you. So we have the polls ready, and the correct answer is B, sebaceous gland carcinoma. Xeroderma pigmentosa is a DNA repair disorder which is extremely sensitive to UV radiation, leading to high risk of UV-related cancers. Whereas on the other side, sebaceous gland carcinoma is not linked to UV exposure, so it is least associated with xeroderma pigmentosa. We had over 55% answer it right, which is still really good considering cancers are the toughest part of a EO quiz. Moving on to the next question. Okay, we have a picture question here. Which of the following is not a true ptosis? I don't think I can explain you the ptosis here. Otherwise, I'll be giving away the answer. But you have 4 different types here. One of which is a pseudotosis. And your time ends there. Our polls are out. And the correct answer is C. C is dermatochalasis, which is an eyelid skin condition, but it's not true ptosis. A is congenital ptosis, B is involutional ptosis, D is mechanical ptosis, whereas C is dermatochalasis. So the correct answer is C. Unfortunately, we had a lower percentage, 35%, answering it correctly. Moving on. BPES includes all except. The whole reason I did not elaborate BPES that will give away the answer. So the options are narrow palpebral fissure, lateral ectropion, telecanthus, and low arched eyebrows. Moving on to our answer. As the picture suggests, the answer, the only thing which was missing is lateral ectropion from the condition. BPS is called as blepharophimosis, ptosis, epicanthus inversus syndrome, which includes ptosis, telecanthus, narrow palpebral fissures. And we had the maximum answer it as low arched eyebrows, but they did have low arched eyebrows in the photographs as well. So it's a very good part of BPS syndrome. Moving on to the next question. Amblyopia in congenital ptosis can be due to anisometropic amblyopia, strabismic amblyopia, stimulus deprivation amblyopia, all of the above. I'm a very straightforward quiz master, so you know the answer is very easy if you think it logically. So moving on to the answer. The correct answer is D. When there is an option of all of the above, always choose it because most of the times you will be right. We had 51% who said it right. So congenital ptosis may be associated with all of the following above. Moving on to the next question. The reconstructive procedure shown in the image is best described as mustardized cheek rotation flap, Tyndall semicircular flap, Hughes tarsoconjunctival flap, Cutler beard bridge flap. Moving on to our answers. So the correct answer is Hughes flap is a 2-stage procedure where we repair large full thickness defects of the lower eyelid. What is happening in this procedure is basically the posterior lamellae, tarsus with conjunctiva is taken from the upper eyelid. It is advanced downward to reconstruct the lower eyelid. The anterior lamellae skin and muscle is reconstructed separately as a skin graft or a flap. After 4 to 6 weeks, the flap is divided to restore the normal eyelid opening. I would have never known that thanks to my wife, who is also an oculoplastic surgeon, who made this question extra tough. Thank you, Dr. Neha Ghosh, for the question. And moving on to the last question of today's quiz for me. Which of the following is not a treatment option for this condition? A. Surgical excision with cryotherapy, topical mitomycin C, topical interferon alpha 2B, and subconjunctival adalimumab injection. I put the pointer there very clearly to make the diagnosis. The polls are locked, and the answer for the last question is D. OSSN is the diagnosis. You can see a clear-cut demarcation line between abnormal and normal, which is pointed out with the white arrow there. And you can see some gelatinous mass as well as intrinsic vascularity in the clinical image. These are the pointers towards the diagnosis of OSSN. So all of the following are the treatment for OSSN except for D. You can do surgical excision, you can do a cryotherapy along with the surgical excision, and you can use chemotherapy for chemoreduction or complete cessation of the disease. That's all from my side today. All the best. Moving on to the next quiz master.
Thank you. Thank you so much, Dr. Raghav, for extensively covering your topics and wonderful explanations. Next up, we have Dr. Sudhakar, sir.
I have to share it in Zoom or what?
Sorry?
I have to share it in Zoom?
No, I'll do that. I'll do that, sir.
Okay.
You can just read it from here.
Yeah, thank you.
So we welcome Dr. Sudhakar Naidu Laveti with his first question for the day.
A 20-year-old man, a contact lens wearer, comes with a 5-day history of left eye redness and pain. And you can see the picture. What is your diagnosis? Option A, HSV keratitis, B, neurotopic keratitis, C, acanthamoeba keratitis, and D, nocardia keratitis. Okay, the poll is locked. Coming to answer. The answer is C, that is acanthamoeba keratitis. This acanthamoeba keratitis is most common in contact lens wearers. In the image, you can see the conjunctival congestion, and cornea is, you can see the neurotopic keratopathy like picture. Okay. The next question.
Neuritis.
Yes.
Why is the tissue from donors younger than 2 years is generally not used in corneal transplantation? Option A is corneal endothelial cells are not sufficient, and the tissue is deeply curved and flaccid, and C, the corneal stroma is too thin, and D is the ethical concerns. Coming to answer. So answer is B. Almost 56% put the correct answer. And the tissue is deeply curved and flaccid. That's why you are not using patients younger than 2 years. But in some conditions where the tissues are not available, you can use it because the tissue handling is very difficult. Coming to next question. Which of the following chemicals is not used for tattooing of corneal opacity? Option A, gold chloride. Option B, silver chloride. Option C, platinum chloride. And option D is hydrogen hydrate. Okay. You can display the answer. So answer D is hydrogen hydrate. Usually for corneal tattooing, all the metallic salts are used, but hydrogen hydrate is not a metallic salt. So the correct answer is hydrogen hydrate. Next question. Identify the microorganism in the Gram stain. Option A, Pythium. Option B, fungal filaments. Option C, Candida. Option D, Nocardia. You can display the answer. So answer is D, Nocardia. Almost more than half the people put the correct answer. In the Gram stain, you can see the gram-positive delicate branching filament organisms with a beaded appearance. So the fungal filaments are a little thicker than these filaments. The next one. Identify this person who did one of the earliest corneal transplant in 1905. Option A is Eberhard Sporel. Option B, Edward Jim. Option C, Sir Harold Ridley. And option D, Professor Kodadast. Okay, you can display the answer. Everybody will think Kodadast because that is the known name, Kodadast line. But the answer is Edward Jim. So Eberhard Sporel developed the technique of collagen cross-linking, not the corneal transplantation. Harold Ridley invented the first IVL, and Kodadast endothelial resection line, named it on the rings. So correct answer is Edward Jim. Next question. So fundus image in a patient with slowly progressive vision loss in both eyes shows pallor of one optic nerve associated swelling of the other. The findings suggest which one of the following? The lesion is in which area? Option A, occipital lobe tumor. Option B, subfrontal tumor. Option C, bilateral optic neuritis. Option D, sequential attack of ischemic optic neuropathy. Okay, 57% of the people who answered the correctly. You can display the answer. So this is a Foster-Kennedy syndrome. So the lesion is and the subfrontal tumor, and the optic nerve develops swelling because elevated intracranial pressure, and the compressor nerve does not develop swelling because of the dead axons. Next question. A 50-year-old diabetic developed a retrobulbar optic neuropathy from aspergillosis. Which paranasal sinus is most likely involved? Option A, cavernous sinus. Option B, sphenoid sinus. C, maxillary sinus. And D, ethmoid sinus. I think most of the people will answer correctly. No. My assumption is wrong. Okay, you can display the answer. Answer is sphenoid sinus. So you can think sphenoid sinus is close to the brain, the optic nerve. When the patient develops optic neuropathy in the setting of fungal sinus disease, an infection of the sphenoid sinus is most likely, because the lateral wall of sphenoid sinus is the medial wall of the optic canal, so it can spread directly. Next question. A patient present with ptosis and horizontal gaze palsy associated with ataxia and areflexia. What is the diagnosis? Option A, myasthenia gravis. Option B, giant cell arteritis. Option C, Miller-Fisher variant of GBS. And option D, cerebrovascular infection of the absence nucleus. You can display the answer. I think this is the only question more than 90% people answer correctly. So answer is C, Miller-Fisher variant of GBS. A 5-year-old boy has a history of bilateral superior oblique palsy. Covered testing would be expected to reveal which one of the following deviations and patterns. Option A, V pattern exotropia. B, A pattern exotropia. Option C, A pattern isotropia. And option D, V pattern isotropia. So answer is V pattern is isotropia. Most of the people answered V pattern exotropia, but it will cause us the V pattern isotropia in down gaze. So the inferior oblique muscle tends to be overactive in each eye in response to bilateral decreased function of the superior oblique muscle, which is responsible for the V pattern. Next question. This is the last question from my side. An infant is diagnosed with cortical visual impairment. What is the most likely finding on pupillary examination? Option A, unilateral RAPD. Option B, sluggishly reactive pupils. Option C, normal pupillary examination. And D, paradoxal constriction of pupil in dim light. So most of the people answer correctly. So C is normal pupillary examination, because the pupillary response to light is unaffected in isolated cortical blindness, because the pupillary pathway ends at the optic radiation part, ends at the before leaving the optic tract. So in cortical lesions, it will not affect the pupillary examination. So thank you.
Okay, thank you, Doctor. I think every part of neuro-ophthalm and squint was totally, thank you so much for this vast coverage of questions and cornea as well. So I guess all of you still have some energy left after those stunning 20 questions, because we are just halfway through. We are just in the intermission of the movie. So the second half is yet to begin. And second half, the first part is coming from a very significant personality in glaucoma. So Dr. Prasanna Venkatesh. So I hope all of you are ready for the first question of his portion. I'll be doing the quizzing part on his behalf as well. So here you go. Identify this line shown in this picture. Okay, so more than half of you have gotten it right. Yes, this is Ferry's line, which is a corneal epithelial iron deposition at the edge of the filtering nerves. Right. Next question. Which of the following complications was significantly more frequent in the tube shunt group in the TVT study? TVT is tube versus trabeculectomy. So this was one of the landmark studies in comparing the gold standard of trabeculectomy with the tube shunt procedures. So, okay. So the answer is diplopia. So it was diplopia that was significantly more common in the tube shunt group compared to the trabeculectomy group, because the tube caused mechanical interference with the extraocular muscles. All right. Moving on to the next question. Identify which of the following is used differently in refractory steroid-induced glaucoma. So all of these follow a particular type of drainage mechanism. Oh wow, I think it's I probably the most equi-distributed answer pattern, 25, 25, 30, 20. So yes, these are all different questions, I mean different types of mix, and we are talking about the mix master setting the question, so you will have to expect these sort of questions. So answer is C. So this is actually ab interno. It can also be done ab externo as well, but the answer is Zen gel stent. Next question, identify the lens shown in this picture. Oh, nice. So yes, you are right. More than half of you have gotten it right. This is the Blumenthal lens that is useful in laser suture lysis. All right. Moving on to the next question. Name the test that is to be done prior to using this, which would help in clinching the diagnosis. Okay. Again, we have a uniquely distributed answer. So this is actually the Simmons-Tamponade shell, which is useful in addressing a leaking filtration bleb, which was used before. So the test you need to do is the Siedel's test, because that will tell us whether the dilution of a fluorescein dye that is applied onto the bleb, the dilution of the bleb, dilution of the dye shows that the bleb is leaking aqueous. So that is the point, right? Okay. Next question. A 2-year-old child is presenting with the bilateral findings shown in this figure. Which of the following would be inconsistent with the presentation? Okay. Okay, so we have again the split distribution. So this is the case of aniridia. So when we see this, aniridia causes angle closure type, neuroblastoma, Wager syndrome, right? But the presentation, though may not be a part of Wager, all of them are actually neural crest cell derivative tube. But what is more important here is point D. Adhesion of the peripheral iris to the prominent anteriorly displaced Schwalbe's line is characteristically seen in Axenfeld-Rieger and not aniridia, right? So the neuroblastoma, yes, was the catch in the question. Everybody would want to think that Wilms tumor is this and neuroblastoma was given as an alternative. But remember, it is also a neural crest cell tumor, right? Moving on to the next question. The change shown in this figure was noted during a preoperative evaluation before cataract surgery. Which of the following statements is false? Wow. Okay, nice. I thought this would be tough, but many of you have gotten it right. Yes, this is not a risk for spontaneous corneal edema following cataract extraction, while the rest of them are very much possible intraoperatively during the case of being operating on a pseudo exfoliation. Great. Moving on to the next question. So a patient is presenting with a cataract and lenticular changes as shown here. Kindly note the slit image before you jump to answer it. Okay. So yes, you could suspect a myotonic dystrophy, but the Christmas tree pattern would be very different and it's more anterior in position. Whereas the reason I put up this is wanted you to appreciate that the opacities are more posterior in nature, and this is likely to be seen in a case of electrical injury, right? Electrocution. Okay. Right. Next, can we move on to the next one? Yes. Identify the false statement for SLT. Wow, okay. 42% have gotten it right. Fantastic. Yes, it is quite effective to do a repeat SLT. All right. Moving on to the last question of Prasanna sir's deck. The genetic mutation going to be associated with this condition. Right. Initially, when Sir designed this question, I thought it was just, randomly naming 3344. But I was amused to know that each of them actually had a syndrome associated with it. So PTEX3 is the answer for this question, PPC. PAX3 is Waardenburg syndrome, right, which can also cause posterior polar cataracts, but associated with hearing loss. PTEX4 is involved in developmental processes, but not linked to this. And then PAX4 is MODD, right? Mature onset diabetes of the young. So that brings us to the end of the third set of questions. So we are on to the last part. So I hope all of you are there with us, right? So moving on to the first question of my deck. Which of the following vitamins or their deficiencies are associated with cystic changes? It could be excess or deficiency. All right. So the answer is C, which is niacin or nicotinic acid, right? The unique feature here is there is no leakage on FFA in spite of these cystic changes. That's what makes it different, right? Okay. Next question. Identify the procedure done here. Okay. This was meant to look like a squint surgery. That is why all this sclerotino-fixation, but there is no such procedure like that. So this was the procedure done as the first corrective procedure for retinal detachment, which earned a gold medal for Jules Gonin, right? So this is ignipuncture. So this was the first procedure ever done for a case of retinal detachment. Moving on to the next question. A 7-year-old male presenting with bilateral RD due to GRTs, giant retinal tears, known to have hearing difficulties, older brother and father also undergone treatments for RDs. Which of the following is the most likely underlying diagnosis? Wow, fantastic. 63% have gotten it right. Yes, this is Stickler syndrome, right? So this is syndromic, and it is a connective tissue disorder. And mostly what we encounter in our practice is type 1. All right. Moving on to the next question. Which of the following studies reported that intensive blood sugar control reduced the mean risk of developing diabetic retinopathy by 76% in type 1 diabetes? Okay. So yes, 43% of you have gotten it right. It is the DCCT, which is Diabetes Control and Complications Trial. Right? There are a few trials which were done on the basic risk factors of diabetes mellitus. Of course, we have a whole list on the different types of anti-VEGFs and different conditions, etc. That's different. But trying to modify the modifiable risk factors, very few studies were done, and this is one of them. Moving on to the next question. All of the following are causes of hyperfluorescence except so it could be retinal, choroidal. I've not mentioned which hyperfluorescence. Fantastic. So most of you have gotten it right, or I would say 40% of you. Yes, it is not seen in a subretinal hemorrhage because that causes blocked fluorescence and not hyperfluorescence. Fantastic. Coming down to the last 5 questions of the day. Identify this ophthalmologist's contribution to which of the following diseases and its management. Nice. Okay. So 43% of you have gotten it right. Yes, this is Mark Amsler. And we all know how important Amsler's grid is in our routine OPD practice for diagnosing macular conditions. Right? All right. Birdshot retinochoroidopathy. Identify the incorrect state. Right? Fantastic. Again, many of you have gotten it right. It affects mostly females and not typically men. All right. Next up, which of the following features is characteristic of Fuchs heterochromic iridocyclitis? Wonderful. Again, this was meant to be a slightly tricky question. They are asymptomatic. I do agree. You mean to say white eye uveitis, fair enough. But they are asymptomatic in the earlier stages only. They present with diminution of vision following complicated cataract. And also, let me quickly go to the answer. Right? So also important to identify them during this usually asymptomatic phase. Right? So this is a very important point. Secondly, though it is called heterochromic iridocyclitis, because of the cyclitis component, they are known to have intermediate uveitis, intermediate uveitis also, and anterior vitritis also. So that is not to be forgotten, meaning you need to dilate and evaluate the vitreous for the same. Okay? Right. Moving on to the next question. Name this famous personality who lost his vision due to ROP. Okay. we have an equi distribution, I guess, but still the majority of you, or I would say the correct answer is having the highest percentage. Yes, this is Stevie Wonder. He's an American singer, songwriter, musician, and a record producer. So another very famous personality who lost his vision due to congenital glaucoma is Ray Charles, who was also a musician. So yes. Coming to the last question of the day. Find out the HLA association with this disease. The most significant one, they could be associated with multiple. Okay, 60% of you have gotten it right. Yes, it is Behçet's disease and HLA-B51. So that brings us to the conclusion of today's quiz. So while we allow the backend team to do the calculations, over to you, Dr. Raghav, Dr. Sudhakar, sir. Your
Thank you, Dr. Niranjan, for a wonderful opportunity. You have been instrumental from the beginning, from the inception of the idea of quiz. And it feels surreal that we reached this far, where we actually hosted the quiz and we had a little over 100 participants do the quiz. It's been a wonderful feeling coming across. And the quiz was really tough. I think I went easy on all of them. Both of you were really strong on your questions, both in retina, glaucoma, and neurophthal. Neurophthal was like I had lost complete hope. I was trying to fill in some questions at least. Then I lost hope when I saw Sudhakar go one after the other. But I think the next generation or the current generation, younger ophthalmologists are much better than me. So most of them were getting 50% right, which is really good number. Hopeful for future, hopeful to do more events. So from me, what I have realized, like I studied in Andhra throughout my journey in medical school or masters, and if we consider Hyderabad also a part of Andhra at that point of time, even in LVP was part of the two Telugu states. We have always been a very secluded kind of a crowd, where we wouldn't really bother about what was happening, or we were not aware of what was happening. So Yossi is giving this amazing platform to all the younger ophthalmologists now. They can look at all of you guys. They can understand that there is so much happening. Most of them are logging in as on their way to APAO, Hong Kong. Most of you, all the young ophthalmologists, can also target and go. You can use all these leaders as your mentors to travel abroad, apply for travel grants. So this is what Yossi opens up for APOS, where you can be a part of a bigger group which has done many things. It's about giving your flavor, adding your flavor of work, along with the experience which all the office bearers or the executive committee members of Yossi will give you. And most importantly, they are all very reachable because they're all very contemporary. They are all very relevant to all the young ophthalmologists who are part of today's meeting. So I would suggest try reaching out, get your Yossi registration. I think that is the first step. If you get a Yossi membership, then you can be part of Yossi community. You get access to a lot of such programs. I keep seeing a lot of journal clubs happening, lot of quizzes happening, lot of extracurricular events happening, which are more fun to be a part of. Otherwise, it becomes so monotonous from day to day. And then you can even attend the YosiCon, which is happening in Delhi, where you can present your papers, look at many other things. They have sessions to tell you which fellowship to join if you are looking for a fellowship, or if you are done with your fellowship, where you can join for your job opportunity. So you'll have so much opening basically to look around and choose from the better part of the country as well. Thank you again for all the office bearers. I think they're all on their flights now. And thank you, Yossi, for giving APOS and us this opportunity to host this quiz today. Over to you, Sudhakar.
Thank you, Raghav. Uh, Thank you, Yossi, for giving me the opportunity. The only one thing I want to tell is I have attended so many conferences, both national and international conferences. But for the first time, I have attended YOSSICon 2025 in Delhi. But I have seen a lot of differences in between. Because each and every conference, say, I'm not criticizing any conference or any organizers, but same people are telling same topics and same things. But YOSSICon, I have seen a lot of difference. I have learned a lot of new things because most of the youngsters are presented the different topics. So I want all the participants to definitely attend the YOSSICon. You can see the difference between other conferences. So that is the only thing I want to tell. So thank you. I don't want to waste the time.
And we are eagerly waiting for the results.
Yes. I just had a word with the backend team. They are doing a fantastic job trying to find out the top 10 in 4 different categories. And I would like to place on record sincere gratitude to APOS and its office bearers because this event was meant to be a collab. Getting the coordination done from Yossi has been a job that we do regularly, and thanks to the supporting nature of the GC. And it was easier, I would say, to get the approval from APOS. I think that was something very phenomenal for young ophthalmologists and Yossi like us, because to collaborate with the state society with such wonderful seniors and mentors, and for them to immediately accept for this event to happen, thanks to Dr. Raghav and Dr. Sudhakar for making it happen. And coming to the participation, I mean, last time when we did the first edition, though it was a little, secluded to TN, we got a really good number of around 60 to 70 participants. But this is the first time we've managed to achieve a 3-figure. So thanks to all the wonderful participants who've stayed with us for more than an hour and a half almost, or at least an hour. And it really takes that extra effort and the pulse to participate in a quiz, because it tests not only your knowledge but also your spontaneity, presence of mind, and much more. So do keep quizzing, because quizzing grows with quizzing, just like any other sport or anything of that sort. So do keep quizzing. And once again, I would like to thank our sponsor of the evening, Beatum Pharma, because they've really come forward to support us in this initiative back to back, and looking forward to much more collaboration with them for the future events as well. So thank you, Mr. Lumen, for making it so easy for us. And
I have one statement. Sorry, I missed out on thanking Dr. Madhu and Dr. Gopal Raju sir, who were instrumental, because anytime we brought up something new like this, because these were not there before in the APOS to do things, but whenever we brought up anything new, even the slightest new thing, even I would actually feel a little worried whether should I really go up to them and ask them, but they never said no. Anything we brought to them about Yossi, either the quiz or the debates which we did before, everything they were really supportive. So I would like to take that opportunity to thank Dr. Madhu, who has been instrumental for this program from happening, and also happening so happily and conveniently. And like Niranjan said, quiz is always fun. I loved quizzes. I would have loved to participate as well, if not being a quiz master. So always keep quizzing. Thank you.
Thank you, Dr. Raghav. Another special mention to the division of participants. We had a phenomenal 42 to 45% of the participants being constituted by postgraduates from Andhra Pradesh. So that is simply remarkable, because this really emphasizes how much interest you all have in wanting to learn more. And I would say proudly that more than 55% of the entire participants list today is from AP, including the US. So that is really a great thing, because we see, this is not because it is just an APOS collaboration. Definitely not, because this mailer has been sent to each and every EOC member through mass mailer, thanks to our secretary, Dr. Nilesh, and the backend team. But in spite of that, constituting more than 50% of the whole participants. That is really a testament and a very substantial reason why we have two exclusive categories for them. So thank you for this phenomenal participation from APOS and its members. And like Dr. Raghav and Dr. Sudhakar highlighted, we have lineup of several such events which are especially tailor-made and curated for young ophthalmologists. And all people who have joined us in our journey have definitely benefited in one way or the other. Either they've gotten the platform to present their presentations or participate in quizzes. So we have something for everybody, right? And that being said, we will definitely post the necessary details and links to become a part of YOSI. And that will open up a horizon of things for all your young ophthalmologists. We are looking forward to much more participation, not just in quiz, but also in YOSI membership in the days to come. Right? So we'll just pause for a couple of minutes and all of us let us take a quick water break or things. We've been in the edge of our chairs. So let's get our VPs back to normal. So the backend team will get back to me in a couple of minutes is what I got a message now. So stay tuned. The most awaited results are around the corner.
Don't go away, otherwise I'm taking your prize.
Sure, Dr. Raghav. Yes. Okay, so we have with us the most awaited results. So request all the quiz masters to join me. And for time's sakes, I'm not going to announce all the top 10. So I'm just going to keep it to top 3, but I'll be displaying the top few in each category, right? So 1 second. Yes. So I first call upon Dr. Raghav to announce. So we have 4 different categories, and thanks to our sponsors that we'll be getting top 10. The first prize is 5,000, second is 3,000, third is 2,000, and the rest top 7 are going to be awarded with Amazon vouchers 500 each. So that is what we have from the sponsors. So that means almost everybody gets to win something and take it back home, apart from the wonderful knowledge and the person, right? So let me share my screen. There we go. So this is the first category, that is Yo Outside AP. Dr. Raghav, if you could just read out the top 3 names of the first, second, and third in this category.
So the first is Ritu Singh. He scored 27 out of 40. Then it is Pranish Ravi, who scored 25 out of 40. And then P. Monica, who has scored 23 out of 40. Congratulations, all 3 of you. And congratulations, all of you who made to this list. So over to you, Dr. Ajay.
Thank you, Dr.
Do we
Raghav.
have them so that we can see them? Do we have Ritu Singh, Pranish Ravi, and Monica with us so that you can?
Please turn on your videos if you can.
Can you turn on the video? Congratulations,
Thank you,
Dr.
sir.
Ravi, Dr. Monica, and Dr. Ritu Singh. Do we have them as well? Congrats, Dr. Ritu Singh. I'm sorry. I thought it was a he. He is a she. So congratulations. And Dr. Monica as well.
Fantastic. Thank you. Next, I invite Dr. Sudhakar sir to call out the top 3 winners of the next category, which is Young Ophthalmologist from AP.
Oh, these are postgraduates, sir, only
These are
only young
young ophthalmologists.
ophthalmologists. Okay. I can't see the full name actually.
Just a second, sir. Just a second.
Yes. The first prize is Dr. Neha Ghosh. Neha Ghosh, she scored 20 out of 40. And second is Pradhana Divya and 18 out of 40. And the third prize is M. Preeti.
Congratulations to
Neha
each
Ghosh
and
is
every
here.
one of you. So I assume that you've taken out time from your practice, busy practice, wherever you are, and joined us. So congratulations on making it to the top 3. Next, we have a very big list. This is the postgraduates from AP. Dr. Raghav, please go ahead and do the honors.
Fortunately or unfortunately, we had maximum competition among the postgraduates in AP.
Absolutely.
But it's nice to know we have the top 3 winners. Dr. Shweta scored 22 out of 40. She is the highest in the state, followed by Dr. Jaypriya and Dr. Sai Harshita. Both at 18, probably because of time.
Yes.
Jaypriya is second and Harshita is third. Congratulations.
Very tough competition, I guess.
It's been woman power from Andhra because all 6 of them are women who have won in young ophthalmology and postgraduate category. Congratulations, all of you.
We're seeing a shift in the pattern. Fantastic. Thank you, Dr. Raghav. And finally, we have the list of PGs outside AP. So first, in this category, we have Dr. Noor Nisha. If you can join us, the PGs who won from AP and from outside, please turn on your video if you can. Next, we have PG, Dr. Ishwar Rajesh. and third is Dr. Gayatri K. So are you there, the three of you? Please turn on your video if you can, so that.
Yes, sir.
Yes.
Congratulations, Dr. Bhunesh.
Congratulations, Dr. Rumi. And Dr. Ishwar.
Thank you, sir. Thank you.
Yes, fantastic. Congrats, Dr. Ishwar and Dr. Gayatri, if you're there. Okay, fine. So,
Dr. Niranjan, we can have a picture, all of us, if you
yes,
have
yes.
all winners.
So,
Winners can turn on their, all of the participants
all
can
of
turn
you,
on.
yes, in
Yeah,
fact.
yeah, absolutely.
So, all the winners, please take note that our sponsors have taken the responsibility on their shoulders to, especially for those in the southern states, because of the proximity reasons, including AP, Karnataka, Kerala, Tamil Nadu, and Andhra. They will be delivering your prices. We'll be handing over the details to them, and they'll be meeting you in person and giving you your prizes. And for those who are a bit far away, you'll be contacted and the prizes will be rewarded accordingly, right? So with that, let's take our mandatory group photo. I request all of you to join us by turning on your videos. Dr. Raghav, would it be, I'll just stop screen share. Would it be possible for you to click a screenshot, if that's okay? All the winners, all the participants, doesn't matter which position you are, please join us, because it takes one extra nerve to be a quizzer. So we know that, and we are very happy to have all of you with us today, and looking forward to seeing you all in the next edition as well. So all those who are here, please turn on your videos.
Quick.
I think this is the toughest quiz. Nobody scored more than 30.
That's because the quiz masters were very tough. I'll give you countdown of 5, 4, 3. All of you smile. 5, 4, 3, 2, 1.
Yeah, one
Again.
Lucy sign, please.
Yeah, absolutely. Why not?
All of you? Yes.
All of you on the count of 5 again. 5, 4, 3, 2, 1.
Perfect.
And Gautami and Leshna came late, so we'll just do the photograph again. 5, 3, 5, 4, 3, 2, 1. Okay, thank you.
Thank you, everyone. Thank you so much. Congrats to everybody, winners, participants, quiz masters, and one and all. So last but not the least, thank you so much, Numerotech team, for making this quiz so flawless and smooth. Because Mr. Sai and myself, we were on a call exactly about 24 hours back, and a lot of things had to be changed, managed, and here we are today. Because of their backend support, we've been able to pull off a stunning quiz with so much participation and a seamless performance. Thank you, one and all, and looking forward to seeing you in YOSI Quiz 3.0 soon. Take care. Good night.
Take care, all of you.
Thank you, everybody. Thank you.